Hi, how are you today?
I'm good. How are you?
Good. So my name is Lucy. I'm going to be taking care of you today. Is there anything specific that you've come in for?
Yeah, I think I have a bump right here from a fall. Fall
Okay.
down the stairs.
Okay.
And I've just been having a few stomach aches lately.
Okay.
And I feel like there's a mole here that I might need to be checked out.
Okay. I can definitely look at those. I'll just start with a few questions. Like your marital status. Are you married, single?
Yes, I'm married.
You're married. Are you guys trying for kids? Is there any chance that you would be pregnant?
No.
Okay. Okay, so we can go ahead. I'm going to start with taking your vitals just to see that everything's looking good.
Sure.
And we can also get some blood tests done if you need to.
Okay.
Thank you. Okay, I'm just going to start by listening to your heartbeat. And if you could breathe in for me, breathe out. Okay. Breathe in, breathe out. Okay, one more time. Breathe in, breathe out. Okay. Just gonna check the back side. Breathe in. Okay, breathe out. Okay, everything sounds good. So I'm gonna go ahead and move on to taking your
Blood pressure?
blood pressure.
Yes.
I'm gonna move on to taking your blood pressure. Have you ever had your blood pressure taken?
I have.
Okay. Perfect. So I'll go ahead and have your left arm go in here.
Is the right arm okay?
Yeah, right arm works. Okay. Okay, and I'm gonna start now.
I can hold that.
Thank you. Okay. Okay, I'm gonna start now. Okay. Okay. Fine. Okay, your blood pressure is looking good as well. I'm just gonna take this off and check your oxidation levels.
Okay.
Oxidation. Do you have any trouble breathing, or do you feel like something's in your way of breathing or anything?
Sometimes I have a little bit of anxiety.
Okay.
Other than that, no.
Okay. So it looks like it's 99/91, which is in normal range. So we can go ahead and start the exam.
Okay, sounds good.
Sorry, I just held onto your arm for no reason.
No, you're fine. I am a little worried about maybe an onset of fever. Could you check my temperature?
Yeah, definitely, definitely. Okay. Okay, 98.2, and we'll just do the temples as well because that's usually the hottest part of the body. Okay, that's 98.3, so there's no fever, but we can keep checking and monitoring you throughout the exam.
Okay, thank you.
Thank you. Okay.
Now you'll put your gloves on and you'll feel my face.
Okay, thank you. Okay, so I'm just going to put my gloves on and I'll have a quick look at your bone structure, your facial structure, just to check that everything's okay.
And you'll check out that bump.
Yeah, oh, absolutely. Okay, I'm just going to start by feeling just the face, and then I will move up to the bump. Is there any tenderness here?
I do feel a little bit, yes.
Was it here, the left side, or the right side?
It's actually both.
Both sides?
I got Invisalign a couple weeks ago.
Okay.
It's been making my jaw really tight.
Okay. So I can have a look at that as well. Okay, any discomfort here?
No.
Okay. Okay, everything feels good. Have a quick look at your teeth before I move on to the bump.
Okay.
If that's okay. Okay, I'm just gonna have a quick peek. Okay, it looks like the discomfort's just coming from the new braces.
Yeah.
And how long are you on Invisalign for?
It's supposed to be 18 months.
18 months, okay. So we can keep monitoring that each time you come back. It's pretty exciting.
Yeah.
Congratulations.
Thank you.
Okay, I'll go ahead and move on to the bump and see.
Sure.
Oh yeah, I see. Big bump right here. Was it on something sharp or was it something pretty dull?
Yeah, I bumped my head and I hit a pole on the street.
Okay, was it the end of the pole or just like the center of the pole? Or...
It was the center of it.
Oh, it's not fun. Okay, it looks raised, but there is black and blue, which is a good sign actually, because that means it's trying to heal. I do just have to check your eyes. We're gonna check for a concussion just in case.
Okay, sure.
Perfect. Okay, I'll have a quick peek in there. Okay, I'm just gonna have a peek with this and okay. It looks like there is some damage in the eyes, so I do just need to do a concussion test for the left eye. If you could look up for me. Okay. We'll have to check if the pupils are dilating. Have a quick peek in this one. If you could look up for me again. Okay, looks like some blood vessels have popped, which could be a sign of concussion. Have you been feeling dizzy or having trouble sleeping at all?
Yeah, I've been feeling quite dizzy and I'm very sensitive to light right now.
Yeah, when did this happen? Was it within the past week or?
Yeah, it was yesterday.
Oh, okay. I'm so glad you came in.
Me too.
Have a quick peek at your eyes just to see if you can follow the light with your eyes. This way. Okay. Looks like your pupils aren't dilating, so we're just gonna have to proceed with caution. Just about concussions.
Okay, maybe sleep in a dark room, you think?
Yeah, I'll have a paper at the end of our exam just to say your next steps. I'll probably have to write a note for you to be out of work.
Okay, sounds good.
Okay, perfect.
How many days do you think?
So I'm probably going to write it for 7 work days.
Okay.
So going into the next week on Wednesday, you'll be able to return. Is this a problem or should I?
No, I think it should be fine.
Okay, perfect. So.
And I did feel like I bumped my nose a little as well, and then I've got a little bit of tinnitus. I thought maybe if you could check my ears.
Yeah, definitely. Okay, so I didn't feel anything when I felt your nose. Doesn't feel like a deviated septum at all. I don't feel anything. There might be some swelling, but there's no bruising under the eyes, which is really a good sign when it comes to hurting your nose. If you hurt your nose, it usually comes swelling under your eyes.
Okay, that's good to know.
Yeah, and it doesn't look like you have that, so
Perfect,
maybe
thank
just
you.
some ice on the nose.
All right.
Perfect, and then I'll go ahead and look in your ears.
Yeah, for sure.
Okay. Looks like you have very clean ears. They are a bit red, which might explain the ringing along with the concussion. Okay, this one does look good. There are some red walls that might come along with the concussion and the ringing of the ears. So I'll go ahead and switch sides.
Oh, sweet.
Okay, I'm gonna go ahead and look into this ear. Okay. So this ear actually has some dried blood, which isn't alarming. Okay, it actually does look like there is some dried blood and wax. I am gonna have to extract a little sample just so I can send that off to the lab to make sure it's nothing alarming. Sometimes it does just happen because it is a hole into the body.
Yeah.
So I'll just do, if you don't mind, just take a little sample and send that off to the lab.
Yeah, for sure.
Thank you. Okay, I'm gonna be very careful, but if anything feels uncomfortable at any point, just tell me and I will stop. I'm just gonna take the tiniest bit because I don't want to rupture anything. Yeah, your whole ear's blocked.
Wow.
Like, insanely.
Crazy. Look what you are.
Okay, I'm gonna scrape this out. Okay.
Oh, wow.
Okay. Okay, I'm gonna go send this off to the lab right now.
Thank you.
Thank you. Okay, I'm gonna go ahead and take my gloves off so we can start some sensation tests.
Okay.
Okay, I'm gonna have you close your eyes.
Okay.
Then I have two things. If you could give me your left hand. Okay. And then if you could give me your right hand. If you could squeeze both and tell me which one's hard and which one's soft.
Hard, soft.
Okay? And then again.
Soft, hard.
Perfect. Okay. Okay, I have two sensations. I'm just gonna have you close your eyes and you're gonna feel one and you're gonna feel two.
Okay.
Just tell me which one you're feeling.
One. Oh, sorry, that's one. Two. One. Two. One. Two. One. Two. One. Two. One. Two. One. One. Two.
Okay, great job. So it looks like your sensations are all good for the brushes. I'm gonna move on to sharp or dull. I'm gonna have you close your eyes. I'm gonna have this be one. Oh, I'm sorry. This is gonna be sharp, and this is gonna be dull.
Okay.
Okay?
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Both.
Good job. Great job.
Thank you.
Okay. to send along with the lab. I just have to grab some pictures of your head just to send to my colleagues to make sure everything looks good. Perfect. I'm just going to move your hair a little bit just to get the edge of the bump. Okay. Okay. I'm going to get those processed now and send them off to the lab.
All right, thank you.
Perfect.
P-O-O.
Okay. Now what word did I spell?
Poo.
Okay. Okay.
D-O-T. Dot.
Perfect. And then I'm going to have you read the numbers right here.
2050.
Perfect. And then which one is the smallest dot?
2.
Perfect. And then which one is the largest one?
9.
Perfect. Looks good. Okay, so I'm going to move on to a smell test. I'm going to spray this twice and then just tell me what you smell. The 3 options are banana, raspberry, and blackberry.
Okay. Banana.
Banana. It is banana. Great job. So I have 3 little jars that I'm going to have you smell. I'm going to have you close your eyes so you can't see the color of the jar. Okay, I'm going to have you smell this one.
Grape.
Yes. Okay, you got 2 more. Okay.
Orange.
Yes. It's blood orange.
Yeah, okay.
Okay, and 1 more. Great job.
Banana.
Banana. Great job. Okay, looks like your nose is all intact with the smelling. And we can go ahead and move on to 1 taste test. I'm going to have you close your eyes. Okay. I'm going to have you try this. Perfect.
Pineapple.
Yes. Good job.
Thank you.
Okay, and now I'm going to have you lay down so I can just have a quick peek at your abdomen to see where this nausea and pain is coming from.
Perfect.
Okay, I'm just going to start with a quick feel. Just let me know if you feel anything uncomfortable. Okay, and do you mind if I pull these down?
Sure.
Okay. Any discomfort?
No, not really. You can just feel it's a little backed up in there.
Yes. Okay. So I'll go ahead and move on to a sensation test. I'm going to have 2 things in rotation. Sorry. Okay. I'm going to have 2 things in rotation. Just tell me which one you feel. This is 1. This is 2.
Okay. 1, 2. 1, 1, 2. 2, 2. 1, 2. 1, 2. 2. 1.
Okay, that looks good. I am just going to have a quick peek into your belly button if that's okay.
For sure.
Okay. Okay, everything looks good. You've got a clean belly button, no bruising, no swelling, no redness. It's a very good sign. And from the look of it, I can see your heartbeat from here, which is a good sign. It means that your stomach is working. Okay. I'm just going to press down. Tell me if you feel any discomfort with me pressing. Okay, I feel some grumbling and some bubbling. How are you feeling right now?
Good. I just feel like there's a lot of pressure in there.
Do you drink a lot of water?
I do, but I could probably be drinking more.
Okay. I could refer you to get a colonoscopy as well. An endoscopy and a colonoscopy will show you exactly what's going on, unless, what is your diet like? Do you eat a lot of veggies and fruits?
It varies. I feel like I should be eating a lot more veggies. Unfortunately, I love bread a lot, and it doesn't agree with me, so...
Okay, so
Yeah.
do you have a history of celiac disease?
Not that I know of, but I might need to get tested.
Yeah, we can do that test here. So it's called an allergen test. I'm just going to do one little prick of wheat, and if it inflames, it means you've got a little bit of sensitivity to the gluten.
Thank you.
Yeah. Okay. I'm going to go ahead and do that. And if it swells up, then we can get you some medicine. Okay. Just one little prick there. Did that hurt?
No.
Good. Okay, and I just have to wait for 3 minutes and see what happens. Okay, 3 minutes passes. Okay, we'll have a quick look at it again. Doesn't look like any swelling, just so it doesn't look like any sensitivity to it. So it might actually just be that you need to do more water, some fruits and vegetables. We can run some blood tests to see if you're missing any vitamins or any of that as well.
Thank you.
Thank you. Okay, and I'm just going to do one more sensation test just to make sure. So what I have, they're both sharp. You're just going to tell me 1 or 2.
Okay.
Okay.
1, 2, 1, 1, 2, 1, 2, 2, 1, 1, 2, 2, 2.
Perfect. Well, everything looks good. I'm just going to put some cold on where we did the allergen test, just to make sure. Okay. Okay. And I'm going to go ahead and put these up again. Perfect. I'm going to go ahead and have you sit up now. Okay, Katharina, so I'm going to go ahead and refer you to a pediatric specialist just so they can have a look at your feet, just because that's kind of out of my specialty. But I have a really good girl who can do it.
Sounds good.
Perfect. Is there any other questions or concerns?
No, I'll just drink lots more water for my...
Definitely. And try and get those intakes of fruits and vegetables as well.
I will.
And don't do as much bread.
I'll try not to.
It's hard, but
Yeah.
definitely. And I'm going to go ahead and tell my receptionist to set you up for a month out visit, just so I can go ahead and see you and see if your stomach's feeling better.
Thank you.
Okay, thank you so much, Katharina.